And moving to another topic, also the third edition of the International Conference on Health, Population, Human Development 2025, PHDC 25, organized on Friday a session on access to innovation in the health sector aimed at enhancing the distinguished and the diagnosis and treatment of the rare and genetic diseases. More details in the following report.
The third edition of the International Conference on Health, Population and Human Development 2025 organized on Friday a session on access to innovation in the health sector aimed to enhancing the diagnosis and treatment of rare genetic disease. Dr. Hussein Abdel Ghaffar, the ministry's official spokesperson, explained that the session focused on promoting innovation in the management and diagnosis of rare and genetic disease. Dr. Mohammed Hassani, Assistant Minister of Health for Health Projects and Initiatives, stressed the importance of early screening of newborns as part of the Genetic Disease Screening Initiative, which has successfully screened more than 500,000 of children nationwide. He noted that the ministry's efforts to expand the initiative increase the number of children diagnosed early and build a comprehensive data ecosystem covering all stages of rare and genetic disease, from risk assessment to treatment to support evidence-based decision-making and health policies. Dr. Mohammed Hassani concluded the session by affirming the Egyptian state commitment to strengthening its capabilities in this field to ensure a healthier future for every Egyptian child. On November 12th, the third edition of the World Conference on Population, Health and Human Development kicked off under the theme Empowering People, Advancing Progress, Creating Opportunities. The third edition of the conference will be taking place from November 12th to 15th at the new administrative capital. The conference included a wide range of events, sessions, and is attended by several officials.
To shed more light on this topic, I'm so delighted to be accompanied over the phone by Dr. Ali Kamel, the former advisor to the Minister of Health. Good evening, Doctor.
Good evening. How are you?
I'm good. Thank you so much. Well, I would like first to ask, what is the key message that Egypt is sending through this year's edition of the Population Health and Human Development Conference?
Well, this important question is, I mean, the authority of Deputy Minister and Minister of Health and Population, Khalid Abdel Ghaffar. He announced the launch of the National Digital Health Strategy 2025-2029 as a part of the third edition of the World Conference Population and Health and Human Development, and from 12 to 15 November, under the patronage of President Abdel Fattah al-Sisi. The strategy aimed to establish a comprehensive transformation of the healthcare system through the development of an integrated digital model that enhances service quality and provides an innovation-friendly environment across the public and private sectors. Dr. Abdel Ghaffar affirmed that new strategy serves as a roadmap for advancing the healthcare sector by leveraging information and communication technology, supporting the creation of human-centered digital health system by 2029. Also, the plan focuses on the ensuring the safe and equitable access to high-quality healthcare services and establishing a unified national data infrastructure that will empower decision makers and enhance the efficiency of service provided to citizens. The minister noted that the implementing the strategy will contribute to improving the performance and resilience of the health system by strengthening data-driven decision-making, facilitating access to digital services, and boosting the sector readiness to adapt to emerging change. This step, he added, is aligned with the state direction toward building a modern healthcare system capable of reinforcing public trust and ensuring service sustainability. And during his participation in high-level panel discussion held on the sideline of the launch. The Minister of Health highlighting the importance of the integrating effort among state institutions to accelerate the digital transformation, and he emphasized that the success of the strategy relies on the adopting whole of the government approach that supports institutional work and ensure its continuity. He added that the ministry is working to develop a flexible and secure digital infrastructures, build the capacities of healthcare workers, and expand innovation to deliver service tailored to citizen needs, stressing that digital transformation represents an investment in people and improvement in patient experience in alignment with Egypt's Sustainable Development Vision. I like also to say that Dr. Rania Al-Mashat, Minister of Planning, Economic Development and International Cooperation, affirmed that citizens' health is a fundamental pillar of economic growth and sustainable development priorities. Dr. Al-Mashat and its strategy, the integration across the sectors such as education, environment, and social protection, ensuring that any health intervention positively influences outcome in other sectors and contribute to achieving national development goal. Finally, the panel discussed featured the participation of Dr. Ahmed Taher Matta, Chairman of the General Authority for Healthcare Accreditation and Regulation, and Dr. Naima El Gasser, WHO representative in Egypt, Mrs. May Farid, CEO of the Universal Health Insurance Authority, and Dr. Tariq Muharram, of Elevator of Capital Management. This is a summary of what is the goal or what is the strategy of Dr. Saad Al-Ghafar, Minister of Health, to help and to change the system, actual system. And as you know, all this effort will help in the social security universal project. If you can imagine the digital transformation and infrastructures and all this effort, it would be very, very important to inform population of what's going on now.
Yes, Dr. Ali Kamel, the former advisor to the Minister of Health, I would like to thank you so much for your informative call.